Before and After Vascular Patient Case Study, a Primary Care Perspective. The Before-After Vascular Patient Case Study illustrates the benefits of integrated vascular healthcare by describing a fairly typical fragmented vascular patient journey, before, in contrast with an integrated vascular patient journey, after, as viewed from a primary care perspective. Please note that the contents of this case study have been reviewed, discussed, and validated by the Vascular Health Strategy Lead contributors, including vascular patients and families, primary care providers, systems leaders, and LIN partners. Meet Mr. Smith. Mr. Smith is a 55-year-old truck driver, married father of 3. He lives in a small town, 30 minutes away from a tertiary care center. Mr. Smith lives a pretty sedentary lifestyle, and he has some other health-related issues. Mr. Smith has recently felt very tired and unusually thirsty. His family physician appointment is in 2 weeks, where his blood pressure is measured at 155/98. Mr. Smith is referred for routine blood work at a separate location a few days later, to a smoking cessation program at the tertiary care center, and to return for blood pressure recheck. Mr. Smith schedules his various appointments. Lab results and BP log are discussed with family physician 2.5 weeks after initial assessment. Glucose levels are high, indicating diabetes, cholesterol is high, and blood pressure diary shows continuing high blood pressure. Mr. Smith finds it difficult to coordinate several trips to separate locations and to manage his work schedule, resulting in anxiety and financial loss due to missed work shifts. His family physician prescribes medications for diabetes, elevated cholesterol, and blood pressure. Mr. Smith is unable to drop off the prescription at the pharmacy for a few days. He is referred to a diabetes education center 30 minutes away for consultation with nurses, a dietitian, and an endocrinologist. He is given a variety of health promotion materials to read when he has time. Mr. Smith finds it challenging to maintain his work schedule and is worried about paying his bills while maintaining multiple medical appointments. His stress is high trying to balance work, family, and health obligations. 1 week later, Mr. Smith has central chest heaviness extending down his arm while carrying groceries. He ignores the discomfort, which subsides in 15 minutes following rest. Mr. Smith's appointment with the cardiologist is in 4 weeks. The next morning at his family's physician's office, his blood pressure is 160/95. More blood work and an ECG are ordered. Aspirin and nitroglycerin are prescribed, and a cardiologist referral is made. He also has appointments at a diabetes education center and with a smoking cessation nurse in a week. 1 week before he can see the cardiologist, he has another episode of chest pain and is rushed to the ER. Mr. Smith is worried about his health and the implications for his family. He feels scared and overwhelmed. At the ER, Mr. Smith is diagnosed with a heart attack, complicated with congestive heart failure. He is given thrombolytics and sent urgently to the cardiovascular lab for coronary angiography. 2 stents are placed in blocked heart vessels. During his hospital stay, he becomes intermittently delirious, and his family reports that his memory has been declining over the past 3 months. Mr. Smith is booked to be assessed at a memory clinic and is sent home on numerous medications. He has follow-up appointments with a cardiologist, his GP, the Diabetes Education Center, a smoking cessation program, a blood pressure clinic, a nephrologist, a memory clinic, and a cardiac rehab. That's 8 appointments. Mr. Smith is unable to coordinate multiple trips to various appointments. He is not aware of any local community-based resources to seek help or further information on how to better manage his condition. With reduced ability to work and no health insurance, he is struggling with financial constraints regarding transportation, costs of medication, and equipment. Mr. Smith is a no-show for the rehab and applies for permanent disability. Mr. Smith is overwhelmed and unable to manage his new circumstances. He is afraid he might die and feels unable to understand or control his feelings of anxiety and fear. He finds comfort in his familiar home environment but becomes isolated and feels alone and disconnected. Now let's take a look at the same patient journey, but this time from the perspective of integrated vascular care. Once again, Mr. Smith has recently felt tired and unusually thirsty. He is assessed by his family physician and a nurse within 24 hours, who are linked to an integrated interprofessional vascular healthcare team, including specialists via EMR and telehealth. His physician briefly advises Mr. Smith on smoking cessation, and the nurse instructs on blood pressure monitoring, as well as options to obtain subsidized, accurate blood pressure monitoring equipment. Blood glucose results are available right away, and and a blood sample is drawn for cholesterol levels at the same visit. At initial assessment, a blood pressure of 155/98 is noted. Mr. Smith feels taken care of, and he has a sense of understanding about his medical condition and a plan on how he's going to get healthy and back on track. He feels confidence in his healthcare team, who has taken quick action with providing him with information and the supports he requires. Test results show type 2 diabetes, high cholesterol levels, and mild hypertension, and are reviewed over the phone with Mr. Smith within 3 days. He also receives health teaching, is informed of community resources, reassured, and scheduled for individual office appointments with a member of his healthcare team. The vascular healthcare team takes time to answer questions and ensures his clarity on next steps. Mr. Smith is encouraged to share his feelings and questions and to seek clarification or understanding on concerns regarding his medical situation. He and his family are engaged in co-creating his care plan with his vascular health care team. The plan reflects Mr. Smith and his family's preferences, input, and personal commitments. The vascular health care team coordinates and manages Mr. Smith's care plan in partnership with Mr. Smith and his family. Mr. Smith feels that he has been heard and has the support of his family and the vascular health care team. This gives him a sense of confidence and control over his healthcare and recovery. Mr. Smith receives the following under one roof: nutritional advice with a dietitian, specialist phone consultations via Regional Vascular Health Support Link, enrollment in a smoking cessation program, home testing advice for blood pressure and glucose monitoring, clear health goals and an action plan, assistance with self-management including tools and techniques, one point of contact to discuss any queries or setbacks in following the plan, proactive monitoring of progress of all members of the vascular healthcare team who are linked through the EMR. Mr. Smith's follow-up visits are coordinated for him. The vascular healthcare team connects Mr. Smith with community-based resources and peer support. Mr. Smith feels well supported and clear about available options. He is confident about taking action on his care plan and solving any problems as they arise. He recognizes that he is not alone and benefits from shared experience and a sense of community. 1 week later, Mr. Smith experiences central chest heaviness extending down his arm while carrying groceries. The discomfort subsides in 15 minutes following rest. He calls his physician's office. An electrocardiogram is arranged and an appointment with his family's physician is made within 24 hours. The cardiologist reviews Mr. Smith's pertinent data from the EMR and with the positive stress test admits Mr. Smith for angiography. Mr. Smith receives a stent and is discharged from the hospital within 1 day. He has follow-up booked with the vascular healthcare team within 1 week. A referral is made for cardiac rehab, who connects the vascular healthcare team to coordinate Mr. Smith's care. Mr. Smith checks his sugars 3 times daily, 2 days per week, and takes a blood pressure cuff with him on the road. He noticed improved blood pressure control due to healthy bagged meals and taking 2 half-hour walking breaks daily. The doctor's note on Mr. Smith's diabetes says in control. He is now exercising, following a dietary plan, and his blood pressure is on target at 122/68. His EMR note says doing exceptionally well. Mr. Smith is seen every 3 months by his primary care vascular health team, where he was initially given a 21% chance of a significant vascular event in 10 years. Mr. Smith and his immediate family feel empowered through learned self-management techniques, and they support each other in sustaining healthy behaviors. Mr. Smith feels supported in managing his stress, which assists him in recovering and maintaining his health. This after case study depicts the concept of a vascular healthcare team based in a primary care setting, which is able to respond timely and effectively to patient needs, co-creates the approach to patient care in partnership with the patient and family, and coordinates and provides integrated patient care through the engagement of a range of allied healthcare providers, specialist services, community services, and supports.